not only had we got the solution wrong, but we had fundamentally misunderstood the problem. If I imagine myself as a parent having to make a decision between, do I feed my sick child today and the rest of my family, or do I take that money that I would otherwise use for food and spend it on bus fare and then fees and prescription costs to bring my sick child in? What a terrible decision that no parent should ever have to make, right? That's exactly the kind of terrible calculus that parents all around the world have to make because of healthcare systems that place the first point of care far too distant from patients and that place the decision of care hand in hand with fees that many patients can't afford to pay. We started sitting down with our neighbors and asking them to tell us their whole life stories. They explained to us that they didn't have a malaria problem or a diarrheal disease problem or a pneumonia problem or a newborn sepsis problem or a dental abscess problem. They had a problem getting healthcare in time. They had a problem with delay, with healthcare systems that were designed to delay or deny them access because they're poor. This system of providing healthcare that meets patients where they are and that doesn't charge any out-of-pocket fees might sound expensive. It actually isn't. It costs just a shockingly modest amount of resources to do. In Mali, our cost estimates are about $12 per person served per year to provide healthcare without fees, both in the home and at upgraded clinics. And delay in access to care is a problem, is an injustice that exists all around the world. It isn't particular to Mali or to West Africa. It is a major cause of preventable illness and death in the United States and also worldwide. And that's a challenge that we and our Ministry of Health partners are taking on together. Community health workers we support spend hours every day going door to door and searching for patients who need care. And as they visit their neighbors one at a time, they are screening for illness. They are diagnosing malaria, pneumonia, and diarrheal disease and malnutrition. In the home, they are identifying the sickest patients who need evacuation, who can't get care in the home, and arranging for evacuation by off-road ambulance of those patients to upgraded primary care clinics. At Muso, we believe that no one anywhere should die waiting, and we see the global child mortality crisis, the global maternal mortality crisis, as solvable now. We have the tools today to make the death of a child rare in every community on the planet. And that is what we are pushing toward. That is what we're struggling and striving toward today.